Today I will be discussing eating disorder awareness. According to South Carolina's Department of Mental Health, approximately 8 million Americans have eating disorders, from which 7 million are women. According to the National Eating Disorders Association, surveys suggest that approximately 20 million women and 10 million American men will have eating disorder at some point in their lives. I recently took a class on eating disorders under my nutrition major requirement and was shocked to learn the increasing prevalence in the world, where in today's society there's such a big focus on body image and food intake. Furthermore, there's so many misconceptions about them that they're cast aside and not taken seriously enough. If someone is very thin, they are praised, whereas if someone is very overweight, they're attacked for it. These ideas and misconceptions about the ideal body have a startling impact on today's society, where millions of people are now suffering from eating disorders. The purpose of my speech is to increase the understanding of eating disorders so that those who have them can receive the proper help that they need. And after having conducted an in-depth research into the eating disorders, today I will be discussing what exactly an eating disorder is, the effect of eating disorders upon an individual, and the treatment plans available. So, what is an eating disorder? As defined by the Merriam-Webster dictionary, an eating disorder is, and I quote, any of several psychological disorders characterized by serious disturbances of eating behavior. Eating disorders are the result of physiological, psychological, and sociocultural influences upon an individual. They take many forms, including but not limited to anorexia nervosa, bulimia nervosa, and binge eating disorder. In a publication titled Eating Disorders About More Than Food from 2018, the National Institute of Mental Health goes over the specifics of these disorders. Anorexia nervosa is described as a disorder in which individuals severely restrict their food intake, have a fear of weight gain, which in turn leads to extreme thinness, and they have a disordered body image in that they perceive themselves to be of a greater weight or size than they actually are. With bulimic individuals, they have recurring episodes of eating large amounts of food with a lack of control and then proceeding to make up for those episodes with compensatory behavior such as the use of laxatives or forced vomiting. The difference here is that bulimic patients are of normal weight or are overweight. And then you have binge eating disorder, which is similar to bulimia nervosa, but without the compensatory behavior. So it's essentially just purging without compensation. And that results in the patients being overweight or obese and struggling to cope with the guilt of their episodes and the stress of the weight gain. According to the Mayo Clinic, some causes of eating disorders include genetics, biology, psychological health, and some risk factors that increase the risk of developing an eating disorder include, but are not limited to, family history, other mental disorders, dieting, and stress. For example, anorexic patients can have a disordered body image because they may be perfectionists and therefore may be prone to the idea of having a perfect body, which in turn is the result of the sociocultural influences that emphasize the idea of thinness as beauty. Another factor that plays a role is genetics of the disorders, which was founded in a study conducted by a psychiatrist named Wade Berrettini in 2004 titled The Genetics of Eating Disorders, in which he found that within families, if one member had an eating disorder, the likelihood of the other family members having it was 7 to 12-fold. Furthermore, he also discovered that amongst twins, there's a significant correlation between the eating habits and body image perception amongst identical twins, which also strongly suggests that genetics is behind the disorders as well. So what is the effect of these disorders upon the individuals? Anorexia nervosa results in extremely low weights and malnutrition, which results in anemia, osteoporosis, amenorrhea, low blood pressure, brittle hair or nails, and infertility. Bulimia nervosa results in inflamed and sore throat as a result of acid from the bile when it comes back up when they vomit. And the acid also has an effect on the tooth enamel. It erodes it when it comes back up through the mouth. Binge eating disorder results in a lot of distress and guilt about binging, which in turn leads back to the binging for comfort. And so it kind of goes around in a vicious cycle. And the effect of these disorders can be so severe to the point where it becomes fatal to the individuals, either through the physical or psychological toll. According to the National Association of Anorexia Nervosa and Associated Disorders, eating disorders have the highest mortality rate of any mental illness. And that leads us to ask, how can we treat or prevent the disorders? So, the 2018 National Institute of Mental Health publication titled Eating Disorders About More Than Food recommends treatment plans, including but not limited to psychotherapy, counseling, proper nutrition, maintaining a healthy weight, medication where necessary, and keeping the patients under a watchful eye. The importance of psychotherapy amongst the other treatments is vital because eating disorders, they don't only take a toll on the physical body but also on the mind, and so they usually begin with some negative perception of oneself or other internal issues. And medication is important sometimes in that it may help suppress appetite, for which could be helpful for patients who are bulimic or binge eating, or it could increase the appetite, which would be helpful for anorexic patients. There are also a multitude of programs for eating disorder patients in which they are monitored to ensure that they are eating appropriately, and they're given counseling and medication, all to help the individuals get back on their feet. So today I talked about what an eating disorder is, what the effects of them are upon the individual, and the treatment options associated with them. The prevalence of eating disorders cannot be ignored in our current society, where body image and food intake are increasingly commented upon. It is my hope that the information presented today will help increase an understanding about eating disorders and how to help those that have them. Thank you.